I'm Zinaida Peric, hematologist and transplant physician from Zagreb, Croatia, and the secretary of the Transplant Complications Working Party of the EBMT. It is my great pleasure to present you the results of the study performed by the Transplant Complications Working Party of the EBMT on the impact of pre-transplant depression and anxiety on the outcome of stem cell transplantation. Knowing that post-transplant depression can severely affect the outcomes of transplantation as well, it becomes very important to evaluate the pre-transplant depression in this setting. However, the data that we have so far are pretty scarce with contradictory results, mainly because most of the studies performed earlier are single-center studies. Also, they usually include both allogeneic and autologous transplanted patients as well. And the single large registry study that was performed several years ago was performed by CIBMTR and evaluated a large cohort of more than 7,000 transplanted patients. In this study, it was shown that pre-transplant depression actually worsens overall survival and increases the rate of acute GvHD. Also, patients who have pre-transplant depression spend less days alive and out of the hospital in the first 100 days after the transplantation. So we wanted to evaluate the same question in EBMT registry patient in a largest study performed so far. So we evaluated all transplanted patients between 2011 and 2015, patients who underwent their first allogeneic transplant for a hematological malignancy. And in this time period, we identified more than 9,000 transplanted patients. The presence of pre-transplant depression was identified in these patients by a question in the EBMT registry on the presence of pre-transplant anxiety or depression requiring treatment. And among these more than 9,000 patients, 9% or 865 had pre-transplant depression. Those patients with and without pre-transplant anxiety and depression were comparable. Only patients with pre-transplant depression were more likely to be female and more likely to be younger. All the other transplant and disease characteristics were comparable, and by using multivariate models of Cox proportional hazards analysis, we found no difference in terms of overall survival, transplant-related mortality, relapse incidence, acute or chronic GvHD between patients with and without pre-transplant anxiety and depression. So this is the largest study performed so far evaluating this question in the transplant setting. However, we have to be careful when interpreting these results, as we know that the tool used for the evaluation of pre-transplant depression and anxiety is incoherent, and of course future efforts should be based on using validated tools for evaluation of pre-transplant depression and anxiety, especially knowing that pre-transplant depression can affect medical adherence, which then can cause, in theory, more GvHD in patients, as well as knowing that patients with depression have higher levels of cytokines as well in the preclinical setting.